Greetings. Welcome to the Medical Minute. I'm your host, Michael A. Weiss. The topic for today's show is a review of a new book by a writer named Martine Ehrenclou. Some of you in the healthcare field may be aware of Martine's work. Her previous book was called Critical Conditions, The Essential Guide to Getting Your Loved One Out of a Hospital Alive. Well, I think she's outdone herself here with a book called The Take Charge Patient, How to Get the Best Medical Care. This is the book right here, so you can see what it looks like. The Take Charge Patient. It's available at all major retailers, on Amazon, Barnes & Noble. There's also an ebook version of it. Now, truth be told, Martine is a colleague of mine. I was interviewed for the book along with many other people, and I believe there's a quote from me on, I think, page 206. But aside from that, let me give you my candid observation why I think Martine has done something so unique and so valuable that it is a must-purchase, must-read, and must-hold as a reference guide. Now, what Martine's done is that she's interviewed a bunch of medical professionals, a very wide range of medical professionals. She's also gone so far as to interview office managers of medical practices, executives at hospitals, and also patients. The information is fantastic because medical professionals will tell you, and they told Martine, that a proactive patient gets the best medical care. Now, I know all of you are aware of the movement called the empowered patient. I believe CNN made this popular, and Dr. Sanjay Gupta does an excellent job along with some other folks doing features on it. Now, I believe that patients need to be empowered, but really what a patient needs to be is assertive. That's why Martine's book specifically spoke to me. And I'm sort of like a professional patient, so if it speaks to me, it'll speak to anybody. She describes in the book how to be a take-charge patient, but also be respectful to medical professionals. That combination will get you the best medical care possible. More importantly, Martine doesn't just talk the talk, she walks the walk, because a large part of the book is based on her own experiences with a very curious and hard to diagnose medical problem that she had. And she went down this journey of misdiagnosis, wrong diagnosis, good doctors, bad doctors, a group of doctors, and she learned so much about how to get the best possible care. So the combination of speaking to this diverse group of people and her own experiences makes for a book that is incredibly valuable. The fact that Martine was so smart to think of interviewing office managers of medical practices, I think is a really good example of why this book is different from every other book. If you're a chronic patient, you understand who works the medical practice. Obviously, the doctor is the person you need to see, but getting to see that doctor and getting the best medical care is usually a function of how cooperative the people in the office are with you. And the office manager manages all of those people. So to get their input, on how to get the best medical care is genius. I mean, it's sort of the first place I go often when I'm not in the hospital and I need to get medical care. I make sure I speak to the office manager, find out what is the office policy, what is the protocol. Should I bring in my records? Should I send them? Should I just be very succinct in a summary? So I was very intrigued when I saw that Martine had interviews with office managers, because I think a person not as experienced as myself, being sick, unfortunately, may look at that and say, why office managers? But in the medical field, if you want to get the best possible medical care, office managers of medical practices are key. Just a little note, but very important one. I think most importantly, she talks about creating what she calls is a health file, which is a separate document, health history, which is a separate document, a health summary, and a medical ID card. Very briefly, a health file is basically who you've been seeing, which doctors, what medications you're on. It's a very thorough document. Your health history has much more specifics. What kind of surgery you had, test results, operative reports, things like that. And then a health summary, which is really a succinct summary of the aforementioned two documents so that you could quickly present it to a doctor during an exam and not overwhelm him or her. And obviously a medical ID card is something that you carry in your wallet that may list the medications that you're on or the condition that you have. Naturally, as you might expect with a book like this, Martine discusses the legal documents that someone with medical problems might have, such as an advance directive, a power of attorney, etc. She also has a chapter on definitions, so that people don't feel embarrassed when they don't know what a hospitalist is, or what a nurse practitioner does, or what a physician's assistant does. This is very good information to have, because if you're hospitalized or if your doctor is busy and he or she says, I'd like you to see my nurse practitioner or my physician's assistant, by reading Martine's book, you're going to become familiar with that. Martine also has a chapter which she calls resources, and it's as thorough as the rest of the book. For example, she has patient resources such as websites, like government websites, medical schools, websites, or just contact information for various clinics and hospitals like the Cleveland Clinic and the Mayo Clinic and very prestigious institutions like that. She also has information about diseases and conditions, numbers you could call to find out about your disease or about symptoms you think which may be a disease. She talks about drug safety and pharmaceutical websites or companies you can call. And she also has sort of a separate part about resources just for seniors. So the book is very user-friendly no matter what age you are. So in summary, by giving you all this information, I think Martine, with her book, The Take Charge Patient, How to Get the Best Medical Care, I think what it does is it actually empowers patients. There's that term, empower, again, because by empowering patients, it gives them the confidence to become assertive patients. Assertive patients are take charge patients who get the best medical care. So I strongly, strongly recommend this book. You will have it for years, and I think you will thank me, and you will certainly thank Martine for taking the time to be so thorough and comprehensive so quickly in a time when people need this kind of information to rely upon. Thank you.